We are back with 20 previous year questions from anesthesia. You are required to answer each question within 5 seconds, after which a brief explanation will be provided to enhance your understanding. Let's begin.
Question 1. Which of the following is an inhalational agent of choice in a 10-year-old child? Here are the options. A. Isoflurane, B. Halothane, C. Sevoflurane, D. Desflurane. And the correct option is C. Sevoflurane. Here is the explanation.
Now, sevoflurane is the best drug for pediatric age groups. Sevoflurane is the best drug for pediatric age group. Why? Because it is the second most fastest induction agent and it has a good smell. And since it is a fast induction agent, the recovery from sevoflurane is better.
Question 2. Which of the following airway devices helps in maintaining FeO2 of 0.25 to 0.60 irrespective of the patient's breathing effort? Here are the options. A. Nasal cannula, B. Simple face mask, C. Venturi mask, D. Non-breathing mask. And the correct option is C. Venturi mask. Here is the explanation.
On the other hand, there is no relationship with the tidal volume and respiratory rate. The machine will deliver the set amounts which the doctor has set for that patient. Right? We see the condition of the patient and we give a fixed concentration and FiO2, right? So these two are different things. When we go and move on into the detailed discussion of all the different types of low flow systems and the high flow systems, you will understand what is happening there. But just now you have to keep in mind that the low flow systems contribute partially to the inspired gases, which is dependent on the tidal volume and the respiratory rate. If the patient's tidal volume is, let's say, 400 and the respiratory rate is 10, then the oxygen delivery will be according to the tidal volume and the respiratory rate. Now, we are giving oxygen because the patient's requirement is more, but it is dependent still on the tidal volume and the respiratory rate. Now, what are the different types of low flow and high flow cannulas? In low flow cannulas, we have nasal mask. I am sure you all might have seen a nasal cannula, a simple mask. These two things you all might have seen. But we have a non-rebreathing mask and partial rebreathing mask as well in the low flow system. Whereas on the high flow systems, we have Venturi mask and high flow nasal.
Question 3. Which of the following is the best method to assess the degree of muscle relaxation? Here are the options. A. Tetanic stimulation, B. Double burst stimulation, C. Train of 4, D. Electromyography. And the correct option is C. Train of 4. Here is the explanation.
The train of 4 stimulus. The train of 4 stimulus. Now guys, this is scoline and these are non-depolarizing neuromuscular blockers. Now guys, when you are giving scoline to a patient, what is happening in that when you just inject the drug, majority of the drug is metabolized very soon. Only 5 to 15% of the drug is available to act on the receptors. Only 5 to 15% drug is available to act on the receptors, right? That means it gets metabolized very fast. So the action of scoline has to be very, very fast to get that muscle relaxation. Whereas when these non-depolarizing muscle relaxants act, what is happening that they go and sit on the receptors. Let's say initial 50 seconds, there will be 50 molecules. Then for the next another 2 minutes, there will be 200 molecules. And another third minute, there will be 1000 molecules. So basically what is happening that the non-depolarizing muscle relaxants are having a gradual effect on the neuromuscular receptors, right? On the muscular receptors. But on the other hand, scoline has to do its effect immediately because it gets metabolized pretty fast. We have an enzyme which we will discuss later on, but it just comes and acts on scoline in such a fast way that scoline has to have its effects very fast. Now, since the effect has to be very fast, when we have these tests, we can say that almost every time we see any kind of change with non-depolarizing neuromuscular blockers in whatever test we do between scoline and non-depolarizing muscle relaxants. Now, for example, in the first test, that is strain of 4 response. Now, in this, what is happening? That we give 4 stimuluses of equal strength. 4 stimuluses of equal strength. That is, we give a stimulus of 1 Hertz 4 times. Now, what is that? It is to visualize at what level the muscle relaxation has been received. Right? We want to test how much relaxed the muscle.
Question 4. You notice this specialized vaporizer being used in the OT. Which of the following gases would you expect it to contain? Here are the options. A. Desflurane, B. Sevoflurane, C. Halothane, D. Isoflurane. And the correct option is A. Desflurane. Here is the explanation.
Vaporizer of halothane is red in color. The vaporizer of isoflurane is purple in color. The vaporizer of sevoflurane is yellow in color, and that of desflurane is blue in color.
Question 5. The correct preoperative fasting recommendation is? Here are the options. A. 4 hours for solids in adults. B. 2 hours for liquids in adults. C. 2 hours for breast milk in infants. D. 4 hours for solids in infants. And the correct option is B. 2 hours for liquids in adults. Here is the explanation.
There were some nil per oral guidelines. Now, what were those? They were a bit separate for the adults and the pediatrics. So, just we will take the adult one first and then the pediatric ones, right? So, what happens in an adult? For example, if a patient is getting operated at 8 o'clock in the morning, I will not tell you about surgery, be it any surgery which requires anesthesia. We ask the patient to not to eat anything after 12 a.m. That is, if the patient is getting operated at 8 o'clock in the morning, we ask the patient not to have solid food around 12 o'clock in the midnight. If the patient is asking us whether he can eat or drink something, you can allow semi-solid foods up to 6 hours. Semi-solid food means dalia or any kind of khichdi. All those things can be taken up to a duration of 6 hours. And if a patient asks you about clear fluids like coconut water or just plain water, that can be consumed up till 2 hours of surgery. That means in this example which I have given, he or she can have clear fluid up to 6 in the morning. Similarly, on the other hand, if there is a pediatric patient who is going to get operated, the patient should be kept NPO for solid foods at same time around the adult one, that is at 12 in the night. If the patient is on formula milk, those formula milks have to be stopped 6 hours prior to surgery. If the patient is on breast milk, the patient should be kept NPO 4 hours prior to the surgery. And similarly, for clear fluids, the patient should be given clear fluids 2 to 3 hours prior to that surgery. Now, why there is a difference between formula milk and breast milk? Guys, breast milk is easily digestible as compared to formula milk. That is why there is a difference of duration between the formula milk and the breast milk. One point not so important to mention, but I'll just mention it over here, that there is as we have American Society of Anesthesiologists, there is a Great Britain and Ireland Anesthesia Society, which says that clear fluids can be consumed up to 1 hour prior to surgery. So this is a controversial thing, but we follow only the American Society of Anesthesiologists guidelines, and these are the guidelines which we are following all over.
Question 6. During the pre-anesthetic evaluation of a patient, the oral cavity examined is depicted in the image given below. The image shows. Here are the options. A. Mallampati class 4, B. Mallampati class 2, C. Mallampati class 3, D. Mallampati class 1. And the correct option is C. Mallampati class 3. Here is the explanation.
Picture which I am showing you right now over here. This picture has been given directly in the examinations and asked about what is this grading known as. What is this grading known as? So there have been direct questions pertaining to these figures. As you can see in this, the hard palate is visible. Hard palate is visible in all of them. This is MPC4 and you can see the hard palate over here. So hard palate is visible in all the 4 structures. Now just see the first one, that is the pillars are visible, the uvula is visible, the soft palate and the hard palate is visible. And as we move on towards the severity of the grade, we see that each structure is diminishing towards the right? So in ASA4, only hard palate is visible.
Question 7. Which of the following induction agents is most appropriate for a patient with cardiac disease? Here are the options. A. Ketamine, B. Etomidate, C. Propofol, D. Thiopentone. And the correct option is B. Etomidate. Here is the explanation.
Important point about etomidate is that it does not have any effect on the blood pressure or the cardiac output. This is a very important point about etomidate, that it does not have any effect on the blood pressure, cardiac output or oxygen requirement of the heart. So if a patient is cardiacally compromised, that the patient requires a general anesthesia. In the previous 2 drugs we saw that they are decreasing the heart rate, they are decreasing the blood pressure and all those things. Now in conditions in which the patient requires general anesthesia and the patient, let's say the patient's 2D echo is compromised, the ejection fraction of that patient is around 40 to 45%. Now we do not want to compromise that situation even more by giving drugs which are leading to fall in blood pressure, which are leading to fall in heart rate. We need to give a drug which does not have any adverse effect on the cardiovascular system, and then at those scenarios we give etomidate because it is not hampering the physiology of the cardiovascular system.
Question 8. During recovery from anesthesia, a patient started experiencing hallucinations and vivid dreams. Which inducing agent is most likely responsible? Here are the options. A. Ketamine, B. Propofol, C. Thiopentone, D. Etomidate. And the correct option is A. Ketamine. Here is the explanation.
So you just try to memorize what is the most important one. For example, in this scenario, like we have in ketamine, we have many side effects. But hallucinations and delirium are the most common. Since it is causing a dissociative anesthesia, a thalamocortical dissociation, it will lead to hallucinations and delirium. So easy to understand, so easy to remember. Thalamocortical dissociation, there is a breakage of linkage which leads to hallucination and delirium.
Question 9. What is the mechanism of action of local anesthetics? Here are the options. A. Block sodium channels, B. Block potassium channels, C. Block calcium channels, D. Block chloride channels. And the correct option is A. Block sodium channels. Here is the explanation.
Right? It is a reversible loss of sensation. Right? It should not be a permanent damage, guys. Right? It has to be a reversible loss of sensation, which is localized to a certain area only. Now, for example, if I am operating, let's say, on the finger of the patient, right? We have different blocks, like we have a ring block, we can have a wrist block, or we can have a supraclavicular block. But if I'm operating on the finger, do I need a supraclavicular block? I can just block the nerves in the area of the finger only, right? Or at a lower level, we do at a nerve level, right? Not at the plexus level. So it is a reversible loss of sensation which should be localized to that area only. Now, how do they act? They act by blocking the sodium channels. They block the sodium channels.
Question 10. Which is the anesthesia of choice in a dental surgery? Here are the options. A. Thiopentone, B. Propofol, C. Etomidate, D. Entonox, and the correct option is D. Entonox. Here is the explanation.
Now, Entonox, again, pin index, you have to remember it as 7. Now, what is Entonox? Entonox is a combination of oxygen and nitrous oxide. That is in an equal ratio of 50% is to 50%. And where do we use? We use this Entonox where we need to have more consciousness of the patient and to reduce the pain of the patient. That means it can be used in dental surgery.
Question 11. Which of the following is contraindicated in patients with acute intermittent porphyria? Here are the options. A. Thiopentone, B. Propofol, C. Etomidate, D. Ketamine. And the correct option is A. Thiopentone. Here is the explanation.
So, in bronchial asthma and COPD, sodium thiopentone is contraindicated. Now guys, just have a look at the next point is about porphyrias. Sodium thiopentone is contraindicated in patients who are having porphyrias, whereas the treatment of choice was propofol. So the patients who are having porphyrias, sodium thiopentone has to be avoided, whereas the treatment of choice or the induction agent of choice in patients who have porphyrias has to be propofol.
Question 12. Identify the given instrument. Here are the options. A. Gedel airway, B. Laryngeal mask airway, C. Endotracheal tube, D. Nasogastric tube. And the correct option is B. Laryngeal mask airway. Here is the explanation.
Even in some hospitals and in some bigger hospitals and even smaller hospitals, we have the usage of classic LMAs because of its cost and easy availability, right? But the classic LMA was the first supraglottic device to be discovered, right? So the first classic LMA was designed by Dr. Archie Brain in the year 1982.
Question 13. What is this device called? Here are the options. A. Armored endotracheal tube, B. Doublelumen endotracheal tube, C. Ringaderelvin type, D. Endotracheal tubes equipped with bronchial blockers. And the correct option is B. Doublelumen endotracheal tube. Here is the explanation.
Now again a modification of an infraglottic device. Now guys, double lumen tubes are very critical to use, right? It's very difficult to use these tubes. So these tubes have a different place in different kind of surgeries, right? Double lumen tubes. You can see in this, obviously you can see as the name suggests, it has two lumens. One is the tracheal lumen and other one is the bronchial.
Question 14. Black body and white shoulder are of which cylinder? Here are the options. A. Oxygen, B. Nitric oxide, C. Helium, D. Entonox. And the correct option is A. Oxygen. Here is the explanation.
Now every gas cylinder, the top part is known as the shoulder, right? The top part is known as the shoulder and the lower part is known as the body. So every cylinder has different colors. Now the oxygen cylinder has white shoulders and a black.
Question 15. The pin index of Entonox is? Here are the options. A. 7, B. 1, 5, C. 2, 5, D. 3, 5. And the correct option is A. 7. Here is the explanation.
We have Entonox, that is a combination of 50% of oxygen and 50% of nitrous oxide. It has a separate pin index which is designated by 7. So Entonox, a combination of 50% of oxygen and 50% of nitrous oxide, its pin index is 7.
Question 16. Which is the best way to recognize the cylinder? Here are the options. A. Color coding, B. Label, C. Pin index system, D. All of the above. And the correct option is B. Label. Here is the explanation.
The labels on cylinders, they are the most accurate initially to identify the content of the cylinder. As I told you, over and over usage of these cylinders can lead to removal of color from the gas cylinders. So the labels which are put on the gas cylinders is the most accurate way to identify the content of the cylinder.
Question 17. Which of the following anesthesia agent is hepatotoxic? Here are the options. A. Sevoflurane, B. Isoflurane, C. Halothane, D. Procaine. And the correct option is C. Halothane. Here is the explanation.
Halothane hepatitis. This is a small table telling us about halothane hepatitis. Now there are two types of halothane hepatitis which is caused by acyl halide, right? I told you in the table that acyl halide is a metabolite of halothane and it causes two types of hepatitis, the type 1 and type 2. Type 2 is more detrimental for the patient because it causes necrotizing hepatitis, and that means permanent damage to liver tissue. Permanent damage to liver tissue. Whereas type 1 is acute self-limiting. That means the liver function tests which are deranged, they come back to normal within a period of 1 to 2 days.
Question 18. Shortest action local anesthetic. Here are the options. A. Procaine, B. Cocaine, C. Dibucaine, D. Chloroprocaine. And the correct option is D. Chloroprocaine. Here is the explanation.
Firstly, that chloroprocaine is the shortest acting. Chloroprocaine is the shortest.
Question 19. During laryngoscopy, best method for checking whether the intubation is correct or not. Here are the options. A. Capnography, B. Air entry on auscultation, C. Ultrasonography, D. Chest movement. And the correct option is A. Capnography. Here is the explanation.
That the confirmation of double lumen tubes can be confirmed by a fiber optic bronchoscope, whereas the confirmation of an endotracheal tube can be confirmed by capnography. When we discuss capnography in detail, you will come to understand how does this help us to understand whether the tube has been placed correctly.
Question 20. In status asthmaticus, anesthetic agent used as bronchodilator. Here are the options. A. Morphine, B. Thiopentone sodium, C. Ketamine, D. Halothane. And the correct option is C. Ketamine. Here is the explanation.
Now, ketamine is the best bronchodilator. Ketamine is the best bronchodilator. Yes, propofol and etomidate are also bronchodilators, but ketamine is the best bronchodilator. It depresses the respiratory system. Pharyngeal reflexes are preserved. That is fine. But the best bronchodilator is ketamine. So keep this in mind that a patient who has had any kind of pulmonary compromise or is having bronchial asthma or COPD, in those patients, you don't have to be reluctant in giving ketamine.
Next up is the foundation subject, medicine. Do join us tomorrow as we dive into the crucial PYQs, which will give you a feel of the exam pressure. Like and subscribe if you learned something new today. See you in the next one.